So, Dr. Ramesh, I have a question for you. What are the kind of urinary problems that you see usually in the children age group that you see? Yeah.
See, one of the commonest problem children get is hydronephrosis, which means collection of urine, stagnation of urine in the kidneys. Nowadays, we are able to pick it up even before the child is born. So, before the baby is born, the pregnancy scan is able to find out that there is stagnation of urine in the kidney, and the parents who are about to deliver a baby are worried what will happen. So, that is when they come to us.
And as you said, are there any other common problems that you see in this children age group apart from the swelling in the kidney, sir?
Yeah. Now, this is one thing which we see in the youngest babies, but in older children, they may develop urine infection, and children do not normally get urine infections. So, when they have a urine infection, we go looking for why it happened, and then we find sometimes a blockage to the urinary tract, or we find that the urine is going reverse. Instead of kidney to bladder, it goes from bladder back to the kidneys. So these are some of the problems which we find when we go looking for why the infection happened. All right.
And as you said, yeah, and as you said, just want to know one more thing because there are lots of parents who come up with an ultrasound report saying that there is swelling of kidney, which you rightly said that it's in medical language it's termed as hydronephrosis. So can you just tell us again about what is the reason for this hydronephrosis and what is the treatment for the same?
Yeah. So when the kidneys are swollen, we tend to grade them. Like when it is very mild and the dilation or the stagnation of the urine is not very severe, we don't even bother about them. For example, if it is only 10 millimeter or something, then we just reassure the parents because they are going to get better. But at the same time, when the dilation or the stagnation, the measurement on the ultrasound is like more than 15, 20, it becomes quite big. Then what it happens is the meat over the kidney gets thin. So the kidney cannot overcome the obstruction or blockage, and then the kidneys start losing the function. So we then ask for further tests to see what is the function, whether the kidney is already affected by the blockage. If that is the case, then we have to relieve the blockage because that is the only way to recover the function which is already at borderline. So this is something which we have to decide promptly by doing some tests, and then if we find that there is a blockage, then we have to unblock it. How do we unblock it? Nowadays we do keyhole surgeries, robotic surgeries. So those open surgeries are being done very little these days. I mean, even in 1 month, 2 month old babies, we can do laparoscopic surgeries and robotic surgeries very successfully. So, with the important thing for everyone to note is we have a cure. We have a cure for this problem. So, that itself is a very positive news. If it is mild, it doesn't need a treatment, it gets better. If it is severe, then there is a cure for it. So, this is a very reassuring thing to know.
Yeah. And I think it is important for parents to understand that this is how it is managed, and they should probably have a proper consultation and not try and Google things because it often lands up to a situation where they don't understand anything and then they panic up. So I think this is one important thing which you shared for the parents. One more thing which I want to know from you is there are a set of children who tend to have more amount of urinary tract infections as compared to their peers. Now, what are the causes that these children do have urinary tract infections, and how can they go about it?
Now, one of the important reason why these children get infection of urinary tract is because they also have problems with their bowels. They don't pass motion daily, or they are constipated, or they are so afraid to pass stools that they sometimes pass motion in a standing position. So they generate a lot of pressure, and then that pressure not only affects the bowel, it also affects the bladder. Also, the stagnation can cause bacteria to grow there, and then the bacteria can easily travel to the next door. The bladder is only next door to the bowel. So if there is a stagnation there, the bacteria can easily travel across, and then the urinary tract gets infected. So the parents need to know that it is important that the child is not constipated, the child is relaxed, and then passes motion comfortably without straining or in a standing position. And these are all basic things, giving a lot of fruits, vegetables, water. The important things, basic things, are very important. But at the same time, we have to do an ultrasound. And we sometimes have to do a test called a DMSA scan to see whether the kidneys are already affected because of this. Because a simple infection may be not that serious, but if there is an infection with the fever, then that can affect the kidneys. So if that is the case, then we have to look for this the urine going back upwards. I told that there is a thing called reflex, where instead of the urine traveling from top to bottom, it goes back up from bottom to top. So if that is the case, then we have to find out whether that is again mild grade or severe grade. If it is a mild grade, then one can wait with the dose of antibiotic for it to automatically get better. But if it is severe, then you have to find ways to stop that. So there are multiple ways to stop it. Again, here the open surgery is slowly getting less and less prominent because we have endoscopic treatment available. We can put a cystoscope or an endoscope through the urinary tract, put some injection into that bladder, and then that will solve the reflex. Or we can even do a laparoscopic surgery or robotic surgery. So keyhole surgery is very prominent these days. So each problem has got treatment. That's what I want to stress.
And I think one bottom line for the parents is never to ignore any urinary tract infection, as if it happens, you just don't take the antibiotics over the counter and keep roaming around without having a proper consultation. And
One more
it's
point I
also,
want to
yeah,
add. One
yes,
more
sir.
point I want to add is these children are unique. They are not adults, or they are not small adults. So they need a proper pediatric surgeon who knows what they are dealing with, and their instruments they need are pediatric. They are very small in size. They are not widely available. So they should go looking for a child surgeon or a pediatric surgeon who actually can deal with these little babies, tender babies.
I think you answered my next question as well. So
Right.
I think it's important for parents to understand that just like there are adult surgeons and there are adult medicine people, both are different, but then they work together as a team. In children also, we have a pediatric medicine, and as Dr. Ramesh said, we have a pediatric surgeon who are child surgeons. So we also work together for the best outcome for your child. So you may be visiting your pediatrician, you should continue that, but then when a surgical problem is there, you should visit a child surgeon for this kind of problems. So there is another problem that we see quite often is a condition wherein the opening on the genitalia of the boy won't be at the tip and it is on the other part, on the under surface. So what is
Yeah.
this condition called in medical language? Should the parents panic to get a urgent surgery done, and what are the outcomes of the overall disease?
Yeah, so this problem is now becoming very common, as you rightly said. We really don't know the reason because a lot of chemicals are there in water, the nature, everything is contaminated. So probably that is the reason why this hypospadias, we call it. Hypospadias actually means that the opening is not at the tip, but it is at the bottom. It can vary from the little bit to a lot of down bottom into the bottom there. Now, this problem is unique to boys, and it can affect their normal passage of the urine. I mean, boys are supposed to pass urine in a standing position, and when they go to school, they have to pass urine like any other boy. So if they cannot pass urine in a standing position and they start practicing like in a sitting position because the urine goes backwards, it affects them psychologically. And it also, can be a matter of teasing, and then they may get depressed, and then they cannot have a normal schooling and friends and all. So it is a very important problem to be corrected well during the first or second year of life, because sometimes you need one or two stage of operations. So only if you complete them before they start schooling, they can lead a normal life with their friends, and then they can have a self-esteem. Now, having a curvature associated with the hypospadias is even more severe, because sometimes the penis is not straight but it is curved and the opening is further down. So this can affect the later fertility, be becoming a father. All those things can be affected. So one has to be like, also be a bit futuristic, and then look at the future impact it has on the sexual function and fertility, and at least by that, for that reason, one has to correct it. Obviously, milder versions of it, you can say that, you may want to wait, but usually if the opening is pretty close to the tip, one can wait. But if it is a little down and then getting more and more down, and they cannot pass urine in a standing position, and then direct the stream away from their feet or their shoes, then they definitely need a prompt surgical treatment.
Thank you for that. One last question from my side is, we talked a lot about problems which need surgery. Now, the parents, as a parent, the most common problem that we think is there any problem to give anesthesia to my child if the child is a year or a two or maybe a three? Because as parents, it gets very difficult to come to a point that a child may need surgery, and then you feel that maybe the anesthesia risk may be very high, or the child may die because of anesthesia. So, what is the actual fact behind it?
So nowadays, the anesthesia is very safe. Even in newborn babies, one can give anesthesia. So parents do not have to worry about the anesthesia at all. And most of the urological problems are not life-threatening. So one can easily correct them without any risk of anesthesia, and then prevent a long-term kidney damage or in needing for a renal transplantation and dialysis in later life. So one has to promptly go for a treatment and then save their kidneys as much as possible, because the anesthesia is safe these days. So that is the message I want to convey. Like, the parents do not have to panic and worry because they have a urology problem. It is fully correctable, mostly correctable with the endoscopic and laparoscopic methods, and anesthesia is safe. And we have experienced pediatric surgeons to deal with them. So we should not be worrying about it, but get the right help and then right treatment from the right doctor.
Okay, with this, we come to the end of this podcast. Thank you so much, Dr. Ramesh, for adding value and simplifying this complicated things for the parents. If you are new to the channel, please consider subscribing to it, because we'll be coming up with
Sure.
more such content wherein we will simplify it for all of the common people, things regarding pediatric surgery. So this is an initiative by Indian Association of Pediatric Surgeons to make complex surgical conditions and standard information about them accessible to all of you, so that you can be less anxious and you can provide the best care for your child. If you have still more queries, you can comment down below. Thank you so much.
Thank you.